Welcome to Case Management and Social Work Magazine Show. I'm your host, Linda Del Bosque. Today we'll be speaking with 4 healthcare professionals from West Suburban Medical Center, and we'll learn more about the new innovative rehabilitation unit for COVID patients.
I'm Dr. Jason Gurss. I'm a physical medicine and rehabilitation physician, MD, and I'm the medical director for the West Suburban Medical Center Sub-Acute Rehabilitation Unit.
I'm Rona Bucal. I'm the director of West Suburban Sub-Acute Rehab.
Case management here at West Suburban.
I'm Meghan Bisping. I'm the director of rehab for West Suburban.
COVID as a medical team and healthcare professionals brought you to this place of creating a space for COVID patients.
Yeah. Well, as a case manager and the person kind of overseeing all the discharges, we were incredibly overwhelmed by the silence that was coming from the post-acute community. We know that they have to protect the residents that they had in place, but we weren't being able to move our patients out, which means that we couldn't move patients in order to take care of the new patients. So I was airing my frustration to Meghan one day going, I don't know what to do. We can't move these patients, and the ER is backing up and people are going untreated. And Meghan took it and ran with it and said, let's talk about this. Let's figure out how we could do it. And the next thing I know, within literally almost 5 days, we had a COVID-19 positive unit.
What were the challenges that you saw and that you overcame?
I can just say from a therapy perspective, right, so most hospitals right now, or I think they're coming along, but therapy is not considered a critical part of the critical care team. So they weren't even going into the rooms of the COVID patients.
They're still not going into the rooms. And when we get referrals, they're like, wait, you need therapy to see the patient? Yeah, so there's a lot of hospitals where they're still not seeing them.
Yeah.
So
it started first, we needed to actually send the therapists into the medical surgical floors because the patients were getting super deconditioned. So we said we needed the consults done, but then also we needed to actually provide treatment because they were getting so sick. And so we would then potentially get them to subacute rehab, and they would need months of rehab, which is not, what these patients need. So it first started with, we made the pitch to administration that, hey, if we're gonna have this COVID SAR unit, we really need to get everybody in on the medical surgical floors. And then when you actually look at a rehab unit, so giving 2 to 3 hours of therapy, there's no regulations, recommendations, nothing. So we, Dr. Gurss did a great job with reaching out. We reached out to basically everybody in the area and said, what is safe? How do we keep people safe? How do we keep somebody in a closed room for an hour with a COVID positive patient and keep them safe while they're exercising and in close proximity? And so, yes, knock on wood, but we set very strict precautions as to the therapists and the nurses go through PPE training every Monday. They co-treat on low-level patients, so they always have a second set of eyes. We're constantly talking about our workflows, and so we have not had a therapist, who's come back positive. And so it was really just, it's the safety of the staff and trying to get them invested. And now people are almost insulted if they're on the traditional side of SAR. They're like, what do you mean I'm not working with the COVID patients today? Which in the beginning they were like, I don't want to work with the COVID patients. So It's been this really big culture change.
Places, other facilities, have they asked to lean on you?
We absolutely have, and we've already accepted many outside referrals from as far away as Hammond and Dyer, Indiana, New Lenox.
Yeah.
A lot of the advocate patients, we're getting referrals every day. We got four outside referrals yesterday.
Oh, more than that.
As well.
Yeah, we're getting referrals from all over the city. That's part of the challenge, though, is because it's such a devastating illness, and the patients are so critically ill, and the constellation of other diseases around it. Yeah. They have strokes, and they have heart attacks, and they have kidney disease, or they're in the ICU for 2 weeks with other infections, or they're coming from a long-term care setting, where they have dementia, where they've been living for a long time, and then a number of people in their setting have been ill. So there are so many other, this isn't just somebody who's coming from home with a specific illness. There's this constellation that we just don't know very much about. And when you're looking at an outside referral, you're just getting a part of a chart, and it's very, very challenging. And we've done really well accepting these patients and talking to our referring facilities and everybody else in the community. The same as we do with we get referrals for all kinds of things. People, you know, they're rehab hospitals all over the place do. And fundamentally, we don't want to treat patients with COVID-19 different.
Right.
I think
The same dignity, the same.
medical discrimination is a real thing. We don't want to discriminate a patient because of any reason at all, their race, their gender, their sexual orientation, or a disease they happen to have. As long as we can keep our staff safe, and as long as we can keep ourselves safe, which is what Meghan was talking about, that's a real serious barrier that we have to look at square in the eyes every single day. But if we can do that, then this is the same as influenza, or the same as sepsis, or the same as any other condition. And if it isn't, then we're discriminating. And there are hospitals that don't have adequate PPE, or they can't put people in isolation because of their therapy gym. Or they don't have the physical structure that we have to isolate the patients the way we can. They don't have private rooms or whatever. We have that luxury. So for us not to do that, I thought would have been unethical.
Yes. Well, definitely, what is one thing you would like other healthcare professionals to know about your rehab unit?
Wow, one thing. What's the?
You're our Don.
Well, our unit is basically one of the best, I can say.
5-star.
Yeah,
Nursing
standards,
facility.
right?
It's got 24/7 nursing care. How can you beat that? When COVID was introduced to our unit, all my nurses was kind of scared because they know 24/7 they're going to be in this patient's room with all this PPE and all this gadget. So educating them, having them, you know, really talking to them and saying that we treat them as the same patients. And we have to do extra care with them because, you know, with these things happening, we don't want to scare them too at the same time. So it's kind of hard. It's like really a long process. We started at the second week of March, kind of getting it built, talking to the nurses. And they said, no, we can't because there's really a lot of hesitation. But we managed it. All of them now are telling me, oh, I'm going to be on the COVID side. It's fine. I'm okay with that, going to the other side. So, yeah.
Yeah, I think what we want them to know is it's what we do.
Yeah, it's what we do.
Yeah.
It's the same as any other patient. COVID-19 for us at this point, I guess it's not that big of a deal.
Yeah.
It's just another diagnosis. If patients need rehab, we're open.
Yes.
COVID there are limitations, but they're not our limitations. We still struggle to get patients dialysis. That's a big barrier, but that's not our barrier. That's an external dialysis barrier.
Yeah.
Sometimes we struggle to get patients back to their assisted living because that facility may require a negative test. But that's not our limitation. We'll take them to us, but then we may need that negative test to get them back home.
Yes.
But we'll bring them to us, and then we'll worry about getting them home, and we'll get that negative test once they come to us. For us, it's the same as having a stroke or a broken hip or any other diagnosis.
Business as usual.
Yeah, we're open and we treat COVID.
Well,
you know, there are things when we have really clear, you know, with Rona and Colleen and Meghan, we came up with what does case management need, what does nursing need, what's therapy need, what can we do, what can't we do, discharge on the nursing end, on the therapy end, with medications, and on the physician end. So our admission criteria, we comb through it a bunch, and we continue to revise it. So when we tell our partnering facilities, you know, this is what when you are sending us a patient, you know, we can't take certain medications. We can't have a person on vets.
Right.
We can't have a person on BiPAP, whatever. we are always revising those. We have those standards and criteria that we're okay with and not okay with, but those are all like environmental limitations that we just can't, we can't get around. But other than that, if we can do it, we do it. If we can get them in, if they need help, if we can provide it, we do.
Is there anything else that you want to share with our viewers, or?
Are you program again?
We're always working on bringing in new patients that are in the community who need more help. So, there are patients who are at home who can't get home services from home. There are patients who are in assisted living who don't need to go to the hospital, but can't stay in assisted living and tested positive.
Oh, really? See, I didn't know that. And is that a conversation that's actually taking place?
Yeah, we're working on it, because if you're in assisted living and you test positive, you can't be there. If they can't house you safely, they have to send you to the hospital. But if you're not sick, then you just wait in the emergency room, basically.
Right, and that's not good for anybody.
Then you get sicker. And
right.
So we're working with our partners in the community to kind of solve some of these other problems that, as we work with our skilled nursing facility partners and our CCRC partners, we're discovering that there are other levels of care that need similar help. If we had more beds, we'd help more people, but we're working on other levels of care as much as we can to, the hospital's been here over 100 years, and it's been serving the west side of Chicago and Oak Park, in the neighborhood that whole time. So it has a strong place in the community, and whatever we can do to help with their rehab needs and their medical needs, we're going to do.
Okay, we'll do. All right. Well, I appreciate it. Thank you, everyone.